Hey friends, today continues my special bonus series on the impact and value of making healthcare consumer-centered. It's a reminder about why we're on this mission in the first place. Now, hopefully most of you caught part one, which was my top advice to health systems based on recent conversations, posts, and ideas. So I'm directing this episode to digital health companies, particularly B2B2C solution companies who sell a product or service where the ultimate user is a health consumer or patient, and it's typically offered through an employer, health system, or health plan. One note on that: for the purposes of this series, I won't be focusing on improving the provider experience because while I understand how important it is, I believe that topic has been sufficiently addressed elsewhere. Now, my first episode in this series, as I mentioned, focused on why health systems should become consumer-centered, which seemed like the right place to start because a lot of foundational questions are still being asked about the value. And hey, you know what? That's great. I'm here to answer those questions. But now I'm looking forward to building on that conversation because you, as digital health companies, don't need to be told why to be consumer-centered in the same way that many health systems do. I feel like that's usually one of the reasons why you started a company. You've not only seen the status quo in healthcare, you or a loved one have likely experienced it and you found it unacceptable, so you challenged that status quo and created a new solution. That mission is at the heart of everything you do, and that's one reason I love hearing those founder stories and getting to the root of that mission. I'm also very aware of the environment in which you play here. In order to accomplish that mission, you have to create margin and be profitable on target. So knowing those things, we want to keep both your mission and margin in mind here, which is why today I'm sharing my top 5 insights for digital health companies to understand your role in making healthcare consumer-centered. It's my belief, in fact, it's my core conviction that this is the way to achieve your mission and your margin. Okay, so what's my number one insight about your role? Number one is your role is to understand consumers more deeply than anyone else. In fact, I would venture to say that it's your role to understand their needs, desires, and expectations better than consumers understand it themselves. The road to progress here means everything starts and ends with the consumer's point of view, and it's your job to inject it everywhere, to everything you do. We've seen how slow it is to view progress when we leave that up to health systems and providers. And listen, I want to keep making this disclaimer that there are reasons for that. That's not their core business. That's not what they were set up to do. That's not necessarily how medical care and sick care works. I'm just trying to make the distinction here that now there's this opportunity. It's one of the reasons that digital health, I feel like, is here and meant to play a vital role in this journey, in this process, right? So one reason why we're focused on that is consumers are fed up with traditional healthcare, but they don't necessarily know that your brand is a way for them to experience something different. They don't know your brand yet. They're not ready to trust your brand yet. One of the biggest things I see is this amazing list of amazing solutions, things that have been designed the right way, things that are offering a better solution to experience healthcare. But that doesn't mean someone's ready to trust it yet. This is where your opportunity exists. So that's your role here, right? And one way to do that is to challenge yourself to spend as much time studying health consumers as you do your competitors, right? How much time do we spend scanning the market, looking for the next market entrant or how we're better than them or what their newest feature or new hire is? How much time are we spending actually studying those needs of the consumers that you're ultimately addressing? So a couple of pro tips here I would venture to share. The first one is to lean on your own experience as a health consumer. Let that inform everything you do. Another one is to find and seek out those first-person data points, those primary insights that drive those nuanced changes in an experience that you're trying to create. Use that terminology, refer to experiences. Many of you are, but many are still missing that opportunity. Another pro tip, the number one thing I've seen in digital health companies is that you still approach consumers thinking that they understand the healthcare system better than they actually do. It's so easy to be insulated the more time that you spend in healthcare working in this field. And yet we have to fight that urge. We have to resist that because that makes us less understanding of the way that somebody else is trying to understand healthcare. Don't assume that they understand even the basics of how their healthcare works. The more you do that, the more you'll be in the driver's seat. And my final pro tip here is the word consumer is first person. Remember, put yourself in those shoes. How do you want to experience care? When we refer to consumers, it's okay to refer to it in the first person point of view. Us, we, ours. How do we experience healthcare? And I'll do my best to do that as much as possible, even in this episode. Okay, so again, number one, your role is to understand consumers more deeply than anyone else. Number two, your role is to create a product or service that's so good that consumers demand it over existing healthcare options. This comes down to the fact that if the thing that you're offering isn't that much better than what somebody is already experiencing, there's a very high chance of it just not scaling and not gaining the traction that you need. On the flip side, the opportunity is huge here. The voice of consumers is still radically underrepresented in the creation of products and services themselves. It might not feel like it, but trust me, it's true. I believe this plays to the strength strength of many digital health company leadership teams who are well versed in things like thinking about and instead of or. For example, if you're talking about, hey, do we offer this service digitally or in person? The answer is yes, offer both. I mean, think about it, right? Good product or service design in digital health makes health systems realize that they have to disrupt themselves in order to keep up. That doesn't happen overnight, and that's not really scaling quite yet, but that's the idea, is that they can look at this greater view of all of the new offerings available in the digital health world and think, we have to keep up, like we have to address these things and disrupt ourselves. Another thing to keep in mind here with your product or service design is the realization that while it's a challenge to engage in traditional care for consumers, it's sometimes even more challenging to find an alternative that you're comfortable with. That reality, that cost of change in a consumer's mind, is one reason I believe why we haven't achieved scale yet on a lot of digital health solutions. And another reason for that is that we're still not thinking broadly enough. We're still not addressing journeys as opposed to individual engagement points. And I'll get to that a little bit more in a minute. But that does have to do with the product or service that you're creating. It can be for one particular area, but you have to think about it in the context of a journey. And in this case, our health and wellness journey never ends in our lives. Okay, so summarizing number 2, your role is to create a product or service that's so good that consumers demand it. Number 3, your role is to educate consumers so they see you as a solution. This is a bit of a daisy chain, right? This is kind of building on one another. Think about a couple of those insights we've just been discussing about consumers and how they engage in their health. The fact that they don't understand healthcare as well as you do. The fact that there's a cost of change in their mind, and it might be just as scary to look for something different, even though they're complaining about their traditional care experiences. This one's pretty simple, but just think about where your brand could stand for something and not be so focused on acquisition that you miss that broader opportunity to connect. People still want to experience healthcare from brands that they trust. And maybe the biggest pro tip here is the reality that in many cases, your competition is a consumer simply not engaging in their health at all. It's not finding an alternative. It's them getting frustrated with the process, getting frustrated with their experience, getting frustrated with engaging with the system, that they just give up and don't seek care at all. That's the competition here. That can help you educate consumers about why it's useful for them to engage at all. And that's a piece that a lot of digital health companies are still missing with their brand work here. So again, number 3, your role is to educate consumers so they see you as a solution. Number 4, your role is to educate health systems, employers, or health plans that you are a solution. Again, we're talking about this kind of daisy chain effect, right? This is a bit sequential, right? You do have to educate that ultimate consumer that you are a solution. But to do that, you have to guide that health system or that health plan or that employer, because the reality is they probably think that they don't need you. You have to sell better into those organizations. I'm a big Shark Tank fan of the TV show, and there are so many episodes where one or more of the sharks has asked an entrepreneur if they're planning to go into retail or if they are in retail already. And when the entrepreneur says yes, they're like, why would you do that? Why would you use retail? Why don't you just go direct to consumer? And that's actually the question I would ask many of you in digital health companies. Do you need to go through a health system? Do you need to go through a health plan? Do you need to go through that employer? Or can you go direct to consumer? If so, that's a very different go-to-market approach, but it's worth asking because those entities, again, you're going to have to do so much selling into them. You're going to have to do so much convincing that they don't realize that they need you yet. When I'm thinking about health systems in particular, you have to remember that health systems really probably aren't ready for you at all. They're probably still feeling defensive from when everyone told them that retail competitors were going to eat their lunch. My biggest piece of advice to sell into health systems is to collaborate with other solution providers and sell yourself into them as part of an ecosystem. If you do that right, you're actually benefiting the B2B side and the B2B2C side. And this is a nuance, right? Because technically you're supposed to come in and just sell a very specific solution to a very specific problem for the health system or for the health plan. And yet the consumer who's ultimately using it wants to see that you are helping them along a journey or an experience. That is certainly one of the reasons why this is not easy to do and why so many don't achieve the success that they're looking for. But that's also one reason why the dialogue around consumer-centric experiences hasn't gotten any further than it has, any faster than it has. Okay, so just be aware of that. Be aware of that's your role, is to educate health systems or employers or health plans that you're a solution here. That's number 4. And finally, number 5, your role is to use your brand for good. Yes, that's my obligatory Wicked reference for this episode. But think about this. Think about the bigger picture here. Think about the opportunity you have as a brand. If you are doing what you're saying you're doing, if you're actually accomplishing your mission or making progress towards it, if you are making healthcare more consumer-centered, you are becoming a trusted source for a consumer. And especially for many digital health players, consumers don't know those brand names yet. They don't know who you are. They might know the product or service you're offering, but they don't know who you are. This is one of the biggest opportunities in front of everyone right now in digital health, is to use that brand for good, become a trusted source for your own good now and for the benefit of others down the road. We all know that we as consumers are sifting through so much misinformation and disinformation every day, and it impacts our desire to try healthcare or look for an alternative, or give up altogether. This is so easy to do, and it's such a huge opportunity for all digital health brands to show that you actually care about helping people live healthier lives. So number 5, your role is to use your brand for good. And well, hey, that's a wrap for this episode. The next episode in this series is my top insights for health consumers. How can we as consumers usher in the consumer-centered era and improve our own experiences along the way? Find out with next week's bonus episode. And as a quick reminder, if you haven't subscribed to our YouTube channel yet, don't forget we're adding content there every week now. In the meantime, thanks for everything you're doing to make healthcare consumer-centered.